Good afternoon. It's Friday. This is the third post. Working my way every day to do the post. We finish office hours early on Fridays, so the last appointment was 1:45 today, and we had a short day. It was a nice day. Fridays are always great. Can't complain on a Friday, as I like to say. And let's see. Yesterday I left off telling a bit about why I went into medicine, internal reasons, kind of superficial or external reasons, and why I'm still practicing medicine, why I still enjoy medicine, working with people and helping people, of course. And let's see, today I guess I'll just give a blurb. I'm going to try to cut it down to 7 minutes today because I have to run home. I have 4 kids. One of them is with my husband. They're traveling up to Maine to see his dad for his birthday, and the other 3 are they're 13, 11, and 8. So I have to get home to them. And let's see, today was a short day, so we didn't do a lot, but I'll just give a 3-minute blurb on why I moved to New York and how that came about. So I did my medical school, undergraduate medical school in Seattle, University of Washington, which is where I'm from. And I came here, New York, did my residency. OB/GYN is a 4-year residency. It's a surgical specialty. And I came here to New York University, to NYU, and NYU is partnered with Bellevue Hospital. Bellevue Hospital is known as one of the oldest hospitals in America. It was the first hospital to have a psychiatric inpatient ward in the 1800s. So when people say this person's crazy, they're gonna be shipped off to Bedlam. Bedlam is referring to Bellevue Hospital, where they had the psychiatric ward, the first psychiatric ward. So I did my residency between 1993 and not 1993, I'm going nuts. Between 1993 to 1997 at NYU, Bellevue Hospital, and at the time we also went out to Queens Hospital, to what used to be Booth Memorial Hospital. We did some rotations there. Now Booth Memorial was bought by Cornell Hospital, Cornell University, so Cornell owns Booth, so we don't go there anymore. But during that time, it was just 3 hospitals. It was awesome, really, really good training, lots of surgical training, lots of surgical obstetrical training, and GYN, of course, is almost all surgery. So that was really good. I moved out to New York because I wanted to change. At the time, Seattle's kind of like it's a small town, semi-big town, but it's a small town feel, and everything's really spread out and small. So I left Seattle to move to the Big Apple. I loved the Big Apple when I came here. Couldn't do a lot because I was a resident, and in 93 to 97, GYN specialty as a residency, we did 36-hour calls. So every 3rd day, we were up all night running the emergency room for GYN, OB, and labor and delivery. It was very busy. It was a lot of fun, but it was very busy and a lot of hours. So we did about almost around 80 hours a week when I was a resident. So I didn't have much time to do anything else in New York. We'd get 1 weekend off a month. It was either a month or every 3 weeks or something like that. I can't recall now. It's 20 plus years ago now. But when I had my little weekend off, I'd do something, or I always had family coming out because I lived in Manhattan, Midtown, New York City. I lived between 1st and 2nd Avenue on 35th Street back then. After residency, I moved to 20th and 3rd, and then I moved up briefly to 116th, and then after that, I moved down to Wall Street. After Wall Street was the Village, West Village, 12th and 6th Avenue. So I just stayed in Manhattan for 20 years. So good life. And medicine has changed a lot since I went into medicine. It's changed an awful lot. Really, medicine was in the hands of the doctors and the hospitals. The bureaucrats in the hospitals really didn't have much say in the practice of medicine because physicians ran medicine. Now, physicians don't run medicine. I tell my patients that sometimes. I say, listen, we're in the age of the golden rule. He who has the gold makes the rules. I don't have the gold. Your insurance plan has the gold, so they make the rules. If you want them to pay for something, you got to follow their rules. And if we, as physicians, want to stay on the insurance policy to provide care for people who have that policy, we have to follow the rules. If I don't follow the rules that your insurance plan sets up, they're not going to renew my contract. I'm not going to be able to take your insurance. I'm going to be out of network. And every 2 to 3 years, the policies have to be renewed. And they can either accept us or not accept us. So you have to follow the rules. So the insurance plans run the rules now. Unless you're paying out of pocket for everything, insurance plans run the rules. And they dictate what's done and what's going to be paid for. So that's my little diatribe there on who's running the show. So doctors don't run the show anymore. We can make suggestions, but we don't run the show anymore. Back then we ran the show. So very, very different. And different management. People don't understand that the management of medicine is changing. Not necessarily for the best in terms of evaluating patients and treating patients, because everything's about money now. The insurance plan, they're running a tight ship, and they want it to be even tighter. They want patients to get tested less for things, and they want us not to write prescriptions for a lot of things. So it'll be interesting to see how over the next 20 years where we really end up in medicine, because it's being run as a business and not as an art or as a health care forum for people. So it'll be interesting. But I said I would keep this sweet and short. So today I'm going to try to end the post every day with something medical, something that's come up, or a patient that's come up today as an anecdote. Today, I think I thought about it during the day when I was with patients, and I think it's going to be a pet peeve today. So I have a few pet peeves. One of the pet peeves are people coming in during their lunch break and hassling and rushing the staff because they have 20 minutes to be seen. So this is Manhattan, everybody walks everywhere. So they have 10 minutes or 5 minutes or 6 minutes to walk here. They have an hour lunch break. So by the time they get here, and including the time for them to get back to their office, they literally have like 26 minutes to be seen. So you have 26 minutes to be seen because you took 20 minutes out for the walk back and forth, and of course you want another 10 minutes to get your food or whatever snack or drink or whatever you're going to get in order to get back to work in time. So now you're giving us 26 minutes. That's 26 minutes to register to get in, to be processed. People coming in for GYN, everybody's changing for something. Now you're going to get processed registration at the front, provide your insurance card, blah, blah. You're going to get into the room, get your vitals, get changed, and then all of that on the exit. So 26 minutes to do that, and for me to see you, get your information, evaluate you, examine you, get whatever tests need to be done. So once you take the registration in, the exit registration out, now that's going to be a good 15 minutes. So now you're giving us 14 minutes to get your vitals, get your complaint, your chief complaint while you're here, for me to come in, see you, do the exam, write the prescriptions, discuss what's wrong, you to ask your questions. You're giving yourself 14 minutes for that. That's stupid. That's really stupid. So if all the stars align for you today, you breathe in, get everything done, there's no hitches with your insurance, it's active, everything's transparent, you get in really quickly, you get out really quickly, you don't have more problems that come up during the exam, then that might work for you. So that works for people some of the time. That's not going to work most of the time. You need to give yourself time. If you're coming to a doctor's appointment, everybody complains the doctor's rushing them. No, you're rushing yourself half the time. The doctors aren't even rushing you. I know I don't rush people. They get all the time they want. But you're rushing yourself when you're coming in during your lunch break, giving yourself basically 14 minutes to be in and out with the doctor. That's stupid. First of all, also, I don't run the time for the show here. Like I said, I don't rush people. So you're at the mercy of the patients ahead of you. So we can be running smooth, click, 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 click on time. Let that patient ahead of you want to cross her legs and ask her 10 questions that she's had for her issues for the last year plus. That's coming to a screeching halt for you, because now you're waiting behind the lady ahead of you. And if she takes a long time, you're not going to be on track for your schedule. So we had someone like that today, rushing in. She's in a hurry. She's on her lunch break. Meanwhile, she's here because she had a positive pregnancy test. I can already tell you that's a more than 14-minute visit. So you don't even need to come in today if you have 15 minutes you're giving us. So she's rushing in, telling everybody she's on her lunch break. That's not going to make me rush the patient ahead of you. I also had she had two people ahead of her. She had a procedure ahead of her, and she had another pregnant lady ahead of her. And now she's giving herself, so she left. She stayed the little bit of time she had, looking at her watch, and then she wanted to get back to work because she had her lunch break that she was here. And you know, once I see her, she's not going to be limiting herself to just getting the information, getting the bloods done, blah, blah, blah. She's going to want to ask her questions. It doesn't work that way unless you're coming in and you have at least a good hour to spend here in the office, not minus transit time, minus processing time. You take out your pre-doctor's time, the pre-eyeball to eyeball, and the post-eyeball. I take all of that out. Give yourself 1 hour to be in the exam room, to wait behind other people, because this is a democracy. I can't bump people to see you. Wait behind other people, be seen eyeball to eyeball with the doctor, get your evaluation, whatever you need done, change clothes, and get out. Unless you have an hour for that, there's not even any sense coming in, because it's dumb. So that's my rant for today. Please don't give yourself your hour lunch break from T-minus 60 minutes from when you leave your cubicle or wherever you are at your office to when you get back in there. Don't give yourself 60 minutes, because that's just you leaving too much to chance. Anyways, I hope everyone has a good weekend, and I'll see you tomorrow from home, because it'll be Saturday and I'll be home. Have a good Friday. Safe travels. Bye.